Hi, it's Lee Brandon here, injury rehab specialist. Now, wouldn't it be great if you could wake up every day and your lower back felt amazing and you could do whatever you wanted to do without any limitations or restrictions? Well, in this video, I'm going to be explaining what are the potential causes of the most common lower back injury, which is damage to the lumbar discs. So whether it's a bulging disc, a herniated disc, it's sometimes called a slip disc, which isn't a correct term, but you'll have heard it called that. Now, the reason why it's important to understand the cause or causes is because you need to address those things to put it right rather than just treat the symptom. It's like if you imagine, your 12-year-old keeps stealing your car and crashing it, to just keep taking it to the garage to get fixed is not dealing with the cause of the issue. So it's really important when we're injured that we deal with the causes. But the first thing we need to do is to identify what the causes are, and they can be quite different even for the same injury. So with a disc injury, one of the most common things to cause a disc injury is a lot of flexion of the spine and of rotation of the spine. Both those things put excessive stress through the discs, particularly the annular rings. Now, when we flex forward, it actually puts pressure through the front of the vertebral bodies, and it pushes the nucleus, which is gel-like within the disc. And over time, done thousands and thousands of times, that can create microtrauma in the annular rings of the disc, and that can eventually bulge, and then that can irritate the nerve, causing you a problem. So if you do something repetitively where you're flexing a lot, now one of the things a lot of people do is sit in a flexed position or a slumped position. Now, when you're seated, that also puts 400% more pressure through the discs than standing. So there's a lot of compression of the disc going on in a seated position, and done over time can damage the annular rings. Any kind of sport done with, again, a lot of flexion, lifting heavy weights, so doing things like deadlifts, doing deep squats, again, can potentially put a lot of stress through the discs. Now, there are some of the more kind of obvious things, and they're kind of things that most therapists would tend to look at. Some of the things that aren't necessarily as obvious, one would be weakness of the gluteus medius muscles. So those muscles help to stabilize the pelvis when we're standing on one leg. Now, when you think about it, we take about 10,000 steps per day. Now, if you've got a weak gluteus medius, what happens is the pelvis will tend to shift up and down when you're walking, when it's meant to stay nice and level. Now, what also happens is that the spine is then curving from side to side, and again, it's pushing the disc laterally. Now, the most common part of the disc to be injured is the posterior lateral part of the disc. So flexion pushes it posterior, side flexion is going to push it to the side. So weak gluteus medius muscles is another cause. Now, another thing common as well is the deep abdominal muscles not functioning properly. So the deep abdominal muscles play a pretty large role in stabilizing the lumbar spine. So when those muscles don't work effectively, you don't get optimal stabilization of those segments of the spine. So then you've got to say, okay, so what's caused the abdominal muscles not to function properly? Well, the first thing is underuse. If you're not exercising enough, it's easy for those muscles to stop firing effectively. Any kind of pain, previous pain, even if you haven't got pain now, can actually inhibit, particularly what's called the type 1 muscle fibers, the ones that are there to be used on a long period of time. So over a long day, those muscles should be able to fire effectively. So pain would be one. Any kind of scars in the lower torso could potentially inhibit those muscles. Also, anything in terms of an internal organ. So if you've got constipation, if you've got menstrual irregularities, any kind of gas, bloating, etc., that can cause inhibition of muscles. Again, what's causing that? It could be to do with the diet, it could be you've got food intolerances, etc. So all these areas need to be looked at. And then one more thing I'm going to mention, which again often isn't looked at, and that's what's called the upper cervical spine, so the upper part of the neck, particularly the first vertebra, which is also known as the atlas. When the atlas is out of position, now the head will always try to keep level with the horizon. Okay, that's really important for our human survival in terms of, you know, when we used to be able to have to hunt and avoid predators. So if the atlas is out of position, what quite often happens is it will cause a head tilt. So in order to correct that, the body will tilt the body underneath it, which are now creating another side flexion in the spine. Again, 10,000 steps a day, doing that day in, day out, 365 days a year, is going to place excessive stress through the discs on one side, and again, more likely to get a posterior lateral disc bulge. Now, the next question is, okay, so what's causing the atlas rotation or subluxation as it's known? Well, that can be a reflex action caused by an imbalance within the eyes. It could be an imbalance within the hearing or vestibular system as it's known, and also within the jaw. So the jaw should remain straight in order for you to chew effectively without wearing your teeth out. So all these areas are areas that need to be assessed in order to find out the cause of a disc injury. So I'll just recap on that. Excessive flexion, so posture needs to be looked at. Excessive rotation, again, posture. Sporting or work activities need to be looked at, and also how you, your technique in terms of how you lift, etc. Your abdominal wall needs to be assessed. Potentially your nutrition needs to be assessed, your internal organs. Your atlas, and if your atlas is out of position, you need to look at your vision, the jaw, the hearing, etc. And one more thing to mention is breathing. So when we breathe in, our spine lengthens. When we breathe out, our spine shortens. Now, part of the function of that is that it helps to pump cerebral spinal fluid up and down the spine and into the brain. Now, when we don't breathe correctly, what will happen is, in order to get that cerebral spinal fluid pumping, a person will start to rock backwards and forwards. Okay, so that will help pump their cerebral spinal fluid. However, again, with that flexion, you're going to be putting more stress on the discs. Now, we breathe almost 26,000 times a day. Again, imagine that, 7 days a week, 365 days a year. Now, after a while, someone will get fatigued rocking backwards and forwards. So then what they'll start to do, they'll start going side to side. So now you're putting sideways stress on those discs as well. So breathing also has to be assessed, but then you need to ask yourself, okay, if someone's got a breathing dysfunction, what's causing that? And again, a couple of key areas can be nutrition. Sugar in the diet is a big issue. I won't go into that right now. And also mental, emotional issues can also affect breathing. So all those things need to be assessed to find the cause of your disc injury, and then you need a proper plan to put all of those things right. So that's all from me today. I hope you found that really useful. Make sure to subscribe to the BodyCheck YouTube channel. Also like the BodyCheck Facebook page, and I look forward to seeing you soon on another video. Bye for now.